Hello, everyone. Good afternoon. I'd like to start with sharing some numbers, and then we're going to talk a little bit more about childcare. So, first of all, we do know now that we have 26,357 reported cases in the state of Ohio. Overall, in the U.S., we actually have 1.4 million cases. And unfortunately, our deaths increased in the last 24 hours by 51 to be a total of 1,534 deaths in the U.S. right now, are 84,000. Next slide. Not a lot new here in terms of our demographics on this. Total tested in Ohio, 231,000 and above. Still seeing this disparity a little bit more toward cases being diagnosed as male. Next slide. Our trends are fairly plateaued. Still nothing that is standing out to me other than we did see an increase of 100 of our hospitalizations in the last 24 hours. And again, our testing numbers continuing to go up. I've been working quite a bit over the last 2 days with our testing team, our team of governors, and really impressed by the work that this group is doing. We'll be having more and more to share, but we're working a lot on not only our supply chain side, but actually how we implement that testing in the broadest way possible in our state, making sure that we get out into our communities where it's most needed, using our zone structure in really effective ways. So I see a lot of exciting work going on there. So I do want to take a moment to talk a little bit about our opening of childcare. And I want to say, I know this is an issue, like everything we're doing, including what the Lieutenant Governor just shared. You know, we really are digging deep on the policy on these issues, and this is an issue that's particularly near and dear to the governor's heart. Not only, we talk a lot about children and the spread of infectious disease there, but the governor is very passionate about the workers in childcare. This has been something he has led on throughout his administration. I want to say, in terms of this policy, and again, I've spent a lot of time, you know, I'm one person, I've always said this is a tip of an iceberg of hundreds and thousands of employees and then volunteers from the community are helping us set these policies. I've been so impressed. I want to just shout out Director of Children's Initiatives, Leanne Cornian, and also with her, Kara Went, who's the Deputy Director at JFS, our Family and Children's Services area, who works for Director Kim Hall. I also want to thank Director Stephanie McLeod from the Bureau of Workmen's Compensation, because she's really helped enable us to be able to do what the governor has asked us, which is to be a leader in how childcare works moving forward. We talk a lot about the cases. We talk a lot about deaths, but there's so much more we're trying to learn about the spread of this disease. So we are very lucky, and today I was lucky to be a part of a conversation with Dr. Walter Gilliam. He is a lead researcher over 25 years of working in the area of childcare at Yale University, who's leading a nationwide study and has agreed to help Ohio dig a little deeper into our childcare system. So we are actually going to not only work with him on his national study, but do some extra work here in Ohio. And we'll be looking at a couple of areas. We're going to look at sort of the families, the children, the workers, and the spread of disease. We're also going to try to understand better what are some of these best practices. We're implementing these new best practices. We're trying to be a leader in the country, but we want to find out which of these practices works best. So again, we're all learning in this together. I see Ohio as being a leader in the country. This is a way that we're taking a really difficult situation and trying to make it better. And one last thing, I really want to talk about the workers. Not only are we very interested in learning about them, any pre-existing conditions they have as well, but how do they go home? How do we all go from these places we come together, but go home and look into, you know, for a worker, what does that mean for the people at home in their lives? So this is a fascinating area of research. I'm really proud, Governor, that we can be a part of that. we want to do our due diligence on all these things, but we also want to learn as much as we can for our country, but for our world, and certainly our childcare is something that's near and dear to our heart. So very excited about that work, Governor. Thank you.
Dr. Acton, thank you very much. As Dr. Acton said, we're excited about the opportunity to do this study, and we're looking forward to the results that we will get back, and we think that will help inform us as we move forward in regard to child care. Ready for questions?
Adrienne Robbins, NBC4, and my question's for Dr. Acton. With childcare now reopening, and at the same time we're seeing the new condition out of New York, multi-system inflammatory syndrome in children that they believe is related to COVID-19, are we gambling on Ohio's children here when we know so little about this virus?
Hi, thank you for that question. So, you know, we don't want to gamble. Gamble's a harsh word on anyone in Ohio. I mean, there's nothing that we care about more than getting our citizens safely through what we're all facing, just a terrible virus. And that means we're all trying to learn how to live with it over the next year or two. And so we know that part of opening in any way we do makes childcare an absolutely essential piece of this. And we're very concerned about just the safety of kids overall, that kids have somebody who are watching them, that they're skilled and the most highly trained people possible, that a parent is not having to make a difficult decision about having to go back to work and support their family and not knowing what to do with their kids. And so we're really trying to do so many things at one time. And we are watching this disease. As I said before, this is a pediatric inflammatory disease. I had the opportunity to be on a national call the other night and hear from Dr. Howard Zucker, who is my colleague and in my position in the state of New York, who really first brought this to the forefront. They have over 100 cases of this that they're looking at now, very detailed work. They're working with cardiologists, rheumatologists, not just around this country in our best children's hospitals, but all over the world. So we're all trying to learn about this disease. We're learning more and more about COVID all the time. And, you know, I know we've heard of a case at University Hospitals here in Ohio, and our team, our infectious disease team, our clinical team, we're working with all our children's hospitals to keep an eye out for this and add, once again, to this body of knowledge as we learn. And what this is, again, just for people at home, we see that COVID has this very exaggerated effect on our, immune response. And that's normally happens in all of us when we fight off infections. But we're seeing the effects of this inflammatory response on our body in all ages, not just children. We're seeing it in strokes and heart disease and kidney disease. But we're trying to learn more alongside all of us in the country about the impact on children. So this will be something we are keeping a very close eye on. Thank you.